right? I'm checking the Mars order. Patient is prescribed 3 liters of oxygen per minute. I'm gathering my supplies, my nasal cannula, and my pulse out. Knock, knock, knock. Or I mean, knock, knock, knock. Hi, Ms. Smith, how are you doing today? Providing privacy and scanning the area for safety. All right. So I've heard you've been having shortness of breath, is that correct? Okay, okay. Well, we're gonna try to solve that issue for you today, okay? Right. So is it okay if I just look at your wristband? So I'm gonna look at the patient's wristband and then I'm gonna scan it. Make sure I have the right patient. All right, perfect. Could you tell me your name and date of birth? And today's date and where you're at? Patient is alert oriented ×4. Okay, so since you have shortness of breath, the doctor has prescribed 3 liters of oxygen per minute. Before we do that, I'm just gonna do a focus assessment and listen to your respiratory system. Is that okay? Perfect. All right. So while I'm doing that, I am just gonna attach this to the patient's finger to check for oxygen saturation levels. Looking for any nail polish or anything. Perfect. All right. So I'm just gonna listen to your chest. All right. Perfect. All right. If you could just sit up and lean forward for me a little bit. I'm gonna listen from the apex to the base in a zigzag pattern. If you could breathe in and out as I move from each position. All right. In, out, in, out, in, out, in, out. All righty, thank you. So, no adventitious sound heard. Patient is just complaining about shortness of breath. And it looks like here, oxygen level is 89%. All right, all right. So besides shortness of breath, are you having any other issues? No? Okay, okay, perfect. Well, I'm just gonna check the Mars to the patient, and then I'm gonna check again the doctor's orders for flow rate. I'm gonna get my nasal cannula, and I'm gonna make sure that it is secured to the oxygen supplying device. I'm making sure that the adjustment is at 3. And then make sure that there's no kink or loops while I'm putting this in. All right. So I'm just gonna gently put it in the patient's nasal flares and tuck it behind the ear. And then I am going to adjust it as needed. Once again, making sure that there's no loops or any kinks. And that's adequate slack for the patient to move around, but yet also secure. I'm gonna make sure that it is in the high fallers position for maximum expansion. Alrighty, how does that feel? Are you comfortable? Okay, okay, well, I'll probably be back in about 30 to an hour just to do another focus assessment, just to see how things are progressing from there. Is there anything that I can bring you? Are you comfortable? Do you need to use a bathroom? Okay, perfect. Call light is right there. Make sure you ring us if you need anything, okay? So at this point, I'm discarding. Hand hygiene. Okay, bed is lowered to the lowest position. I'm just gonna come back and check up on the patient in 30 minutes to an hour, just to make sure that everything's going along. And providing privacy, bye. So when I come back and I do the assessment, I just wanted to mention that we do have to check the skin integrity of the patient. So surrounding the nasal cannula would be the nasal flares, the cheeks and behind the ear. Anything greater than 4 liters of oxygen per minute, you would have to use with a humidifier just so that the oxygen doesn't dry out the nasal mucosa.